Good morning, good afternoon, good evening, everyone. I'm Judy Lewis. I'm the board chair of Women in Health Together for the Future. And I'm just going to make a very brief introduction because we're very happy to be able to have this workshop today to help those of you who are interested in preparing an application for the mini-grant program to learn some skills that will be helpful in putting the proposal together. And we've got a great team from the University of Limerick, led by our colleague, Khalifa Elmusharaf, who will be leading the workshop. And so I'm going to turn it over to him. Thank you.
Thank you. Thank you very much, Judy, and welcome everyone to this workshop. So let me first share my slide. So today I have a team with me from University of Limerick with an accumulated experience of more than 100 years between all of us. And what we are trying now today to do is to give a different way of thinking around how to apply to the Women in Health Together for the Future mini-grants application. So the title of our presentation is Design Thinking Approach for Developing Community Projects. The workshop will be divided into 3 sections. I will start with a brief introduction, and then we will have a session about the logic framework and how to use the logic framework in a way to organize our application. Then the next session will be around design thinking. How can we think differently to design or redesign projects that will prevent gender-based violence, which is the call for this mini-grants. So I have a team of 8 with me here, 8 speakers. 2 of them are faculty in the University of Limerick, and 5 are students with us in the Master of Public Health. I will introduce all of them one by one. I start with myself first. My name is Khalifa Elmusharaf. I'm the director of the Public Health Master Program at the University of Limerick. McDonald's is a medical registrar in Dublin, and he was graduated from medicine and pharmacy in Romania, and he is currently a public health student in the University of Limerick. Sebastian is a project development officer in non-for-profit organization in France and worked for many years as project manager, and has a master's degree in communication, humanitarian, and solidarity from France, and he's currently a master's student at the University of Limerick. Nihal is a pediatrician, pediatric clinical tutor, and lecturer at the University of Limerick, and she was graduated from the Faculty of Medicine at Alexandria University in Egypt, and currently is a public health master's student at the University of Limerick. Azjad is a dentist, researcher, health promoters, and she was graduated from the Faculty of Dentistry at UMST University in Sudan, and she's currently a public health master at the University of Limerick. Noha is my colleague here in the program. She's a lecturer in public health, and she has a master's degree in global health, PhD in global health, and postgraduate diploma in statistics from Trinity University in Ireland. And she's the module lead for the ULM Master Program Public Health on design thinking in global health and coordinating the student research project module. Anne is a consultant on service development at Health Service Executive here in Ireland, and she has more than 20 years experience working, providing housing support in areas of addiction, mental health, and homeless. And she has a master's degree in peace and development studies from University of Limerick, and currently is a master's student as well in the public health here with us. Sonika is a postdoctoral researcher in public health in the University of Limerick. She has a bachelor degree in dental surgery from India, MPH and PhD of public health from Punjab University in India. She was involved in the design and implementation of the master program and currently supporting the development of the new doctoral program in global health and global maternal health in the University of Limerick. So this is my distinguished guest and will help me today to deliver this workshop. But before going into the mini grants, just to give a snapshot about what is the Women and Health Together for the Future vision. So the vision is a world where healthy, empowered women are recognized and contribute to their communities, where gender equity is a reality for all and women's rights are respected. And this vision drives all the work that the Women in Health Together for the Future contribute, particularly for the mini grant. So the idea of the mini grant this year is that the Women Health Together for the Future will support community interventions in different aspects of women's health, but focusing on gender-based violence, including the impact of COVID-19. So if you look at the grant application in the website and attended the webinar last week, you will know that there are some requirements to apply for this grant. So we will have 10 grants. Each grant is $1,000. The applicants must be a member of the organization. The membership is very nominal, and you can do that through the website. You need a collaborating team of at least 3 people: an early or mid-career academic staff, a student, could be undergraduate or postgraduate, and an affiliated community organization representative. All the applicants must be from low and middle income country. The application form includes different elements, but these are the most important elements when we talk today about logic framework and design thinking. So we are talking about the setting, the goal and the objective of your project, the audience, the methodology that you are using, the activities that you are doing, the expected outcomes, and the budget and the justification for the budget. The deadline for the mini grants is May 2nd, 2021. All the informations are available in this website. So the first session will be now around the logic framework. So how can we use a logic framework to help us align our components of the application together and think in a logical way? Mark will give a short presentation that followed by 3 minutes video. And then we'll have Sebastian, Nihal, and Asjad presenting some examples of their work using logic framework to give you more practical experience before going to the second session. So now I would like to ask my colleagues and student, Mark, to start his presentation.
Hello, everyone, and thank you, Dr. Khalifa, for that excellent introduction. I'm going to be talking a bit about the framework that would guide the applicants on how to get their grants ready, and also to help them with filling of the forms. So for today, we're going to be talking about logic model. Can I get the slides put up and I can start talking about it? Now, first things first, before we talk about logic model, I want to share a bit background on what theory of change is. Theory of change is some sort of document that outlines how things we do are connected to the changes we want to see. It can take many forms. It can be a narrative report. It can be a picture. And in this case, we're going to be talking about logic model. When we develop a theory of change, the end product is often some sort of document, but the benefits of developing a theory of change is not necessarily that document, but the amount of thought and critical thinking it takes to consider whether the activities you plan is actually going to lead to the changes and results that you want to see. Now, a logic model is a graphic representation showing a sequence of events that brings about change. A logic model depicts your program logic, shows why your strategy is a good solution to the problem you're trying to solve. It's a diagram with text that describes and illustrates the logical or causal relationships among program elements and the problems to be solved, thus defining the measurement of success. There are other terms of logic models such as roadmap, program framework, or program theory. Now, when do we use logic model? Next slide, please. When it's a good time to create logic model? It's when we are developing a program or project, or another is from an existing program that we want to enhance or make it better. Perhaps your funder requires a logic model as part of a grant. It can be a description to help create your measures from inputs through activities, outputs, and various levels of outcomes. It's a living document that will change over time depending on your activities and your results. You might think of a logic model as similar to a financial budget. You build it based on what you know at the time. And then when you look at the results regularly, you can probably have one or two things changed. Also, it's used for planning. You can see how it's used to explain how program works. It can be used to make timelines, identify partners. It's also used for evaluation. You can use it for documenting accomplishments, organize evidences from the program. You can use it to prepare reports, or you can use it to tell the story of the program. Now I'm going to be talking about the components of the logic model. Next slide, please. So there are 5 components of logic model. We have the purpose, the inputs, the activities, the outputs, and the outcomes. And I'm going to be talking about each of them. So the first one we're going to be talking about is the purpose. So what can also be your which this purpose can also be your aim. It can be your goals, or it can be a mission that you're trying to achieve, or an impact statement. It can be brief 3 to 4 sentences describing what your work is. For this part, we want you to ask yourself, what is the problem being addressed, or your mission? What do you do for what are you doing it for? How do you do it? And why are you doing it? And also remember, it's a working document and it's never perfect at the beginning. And it's very easy to get caught up in trying to perfect it. Resist that temptation, and you can improve on it over time. Just get going and start using it to reap the benefits. The next is inputs. The inputs are resources or investments to improve your work. What things that you invest, like funding, staffing, equipment, expertise, supplies you might need. And when you think of things you need to implement your work, and also ask yourself, what do you have? How do you think of your mission? And what is your reason for this existence? Next slide, please. Now, for the activities, activities is basically a list of things you plan to do. With those inputs at hand, what do you actually do to carry out your mission? Things like arranging a peer group meetings in the community, training of staff, interview preparations or resumes. And as well as you can think of diverse guest speakers, perhaps. So depending on the activities that it's related to your program, you can have this. And we'll go to outputs. The outputs are directly related to your organizational activities, they are quantifiable or ways we can count what you're doing. I.e., you can think of number of people participating in the program, number of sessions that will take place, number of classes you're organizing, number of paid internships, how many lives have you touched with the program? Is it 1,000? Is it 500? Is it 1,000,000? Or is it nothing? And that's what the outputs are. The outcomes are related to impacts on community that you are engaging with. There are changes you want to see because of your work you are doing. There are usually changes in knowledge, your attitude, or behavior. It can also be changes in policies, systems, or environment around you. Look at a list of activities and ask yourself, why are you doing that work? What changes do you want to see? You might also have to organize work in short-term, intermediate, or long-term changes. For short-term changes, there are usually changes that happen right after an activity. And for the intermediate are broader changes after the short term. And the long-term changes, they are the broadest and they take the longest time to happen. They are the changes that you might not have a direct impact on, but you can contribute to. Now, this is just an example to show you what a logic model might look like. So what is my mission here? My mission is to make an orange juice. My inputs will be things that I need to make this happen, like knife, cup, orange, juicer, and a juicer machine. And the activity would be cutting the orange and juicing the orange. The output is a cup of orange, and the outcomes is drinking the orange, which could be a short-term outcome. The intermediate could be having vitamin C nutrients from the orange juice, and the long term is to prevent scurvy disease. So this is an example of what a logic model looks like. Now, this is also an example of a logic model for tuberculosis control effort. And you can see the purpose of mission was to improve health and well-being by a collaborative effort to reduce the incidence of tuberculosis. The inputs and the resources is to get staff trained, to help to get info systems, to arrange for clinics, labs, and pharmacies. And the activities is to identify the TB cases or to diagnose causes of local cases. The outputs is to begin the treatment, or the number of persons beginning treatment, or number of people completing the treatment. And the effect is to cure affected person or to reduce the TB rate in this community or to improve health status. Thank you.
Thank you very much, Mark. You asked me to share a video with 3 minutes to come with your presentation. So I'm going to do that. I hope that it will work. So if you hear the sound, just let me know.
Looking for a free project?
Sorry. Okay, so good. Mark, can you hear the voice?
Yeah, I can. Yeah.
Perfect. Okay.
Data is everywhere. No, really, you use it in your everyday life. You collect, analyze, and act upon data when you do anything, from handling your household budget, counting calories in your diet, or figuring out the ideal time to leave for work. So, if data is everywhere and you interact with it daily, why is this culture a recurrent theme in healthcare settings? And how can we turn that culture into this one? The simple fact is, you can't ignore data when trying to improve the quality of healthcare. Data is an essential part of our work. It shows us what needs to improve and whether or not specific actions are helping make these improvements. Don't know where to start? Why not start with the logic model? The logic model helps you determine what data you need, how you're going to collect it, and what the data is going to tell you. It's like a roadmap, an overview snapshot of what you're doing, and a great first step toward creating a new positive relationship with data. Let's work through an example. First, ask yourself, what are your short and long-term goals? Then, fill in the rest of the diagram with the information you already know: inputs, outputs, assumptions, and external factors. Inputs are what you invest, like staffing, funding, equipment, and technology. Outputs are the activities you're doing and whom you're doing them for. Assumptions are what you already know. And external factors are things that are out of your control, like organizational changes and environmental factors. Don't feel like you have enough information to start? The logic model helps you identify the data you need and tells you what's missing so you can figure out how to fill in the gaps. Feel like you have too much data and don't know what to do with it all? The logic model helps you organize and prioritize the data to avoid overcollection. Feel like you can't do it alone? No problem. To make the greatest impact, an organization should collaboratively develop and use logic models at all levels and staff positions for a shared sense of ownership and accountability. And the best part about logic models, they're flexible and evolving. You can create your logic model based on your current understanding and then revise it as you go along. Say your organization wants to improve staff retention. This is what your logic model might look like. Again, inputs are what we invest. Outputs are what we are doing. And outcomes are our goals. Assumptions are existing knowledge. And external factors are things that might matter, but we can't control. In a struggling healthcare culture, data is everywhere, but nobody knows what to do with it. The team that takes the time to create a culture shift around embracing data, using the logic model as a guide, builds a stronger value proposition, which in the end is better for business and patients and residents. What kind of data culture do you want to create?
Okay, thank you very much, Matt, for this presentation and the video, and which give the basics of the logic framework and how to use it to improve the application form. So thank you very much. I would like now to ask Sebastian to give a brief overview of his project around disaster preparedness in a community exposed to natural hazards. Sebastian?
Yeah, thank you. Thank you for inviting me. I'm really delighted to be with you today and to be able to share my experience of working with my little experience of working with a logic model. So we will take a concrete example, and its example is a project I developed a few months ago as part of this master's degree. It's a fictional project about disaster preparedness. And well, to be more concrete, the aim of this project I would like to talk about is to increase the level of disaster preparedness in a community in the Caribbean, a community which is highly exposed and vulnerable to natural disasters such as hurricanes, earthquakes, or tsunamis, and so on. So we are far from the topic of gender-based violence, but well, anyway, the logic is still the same, so it's gonna be fine. So yeah, we have the final outcome here. And what do we want to achieve with a program like this? What we want individuals to take protective measures before a disaster, such as storing food, storing water supplies, preparing an emergency kit. And we also want individuals to adopt protective behaviors when a disaster strikes. So this is our final goal. But between the moment when we start implementing our activities and the moment when we reach this goal, there is some time, obviously, but there is also a chain of events. And I think that the logic model is really good, is a really good tool to demonstrate and quickly visualize this chain. So we'll start with the first section, and we'll build the logic model step by step. So the first section is the inputs. And as McDonald said, the inputs are all the activities that you need to implement your, all the resources, sorry, that you need to implement your activities. So here in this program, we have human resources, we have educational and training related materials, we have also funding. I could have been more specific. I also decided to make a distinction between internal and external human resources because I wanted to be aligned with my budgetary approach. So it's a choice. That's the point I want to make. You can decide, and I don't think there is a right or wrong way to specify your inputs. So then we will move on to the activities, which are closely related to the outputs. So for this program, we have three main activities. We have educational sessions, we have workshops focusing on practical skills, and we have also drill exercises involving the community members, healthcare workers, firefighters, and so on. So in front of each of these boxes, activity, we have the outputs, the metrics that we will be using to measure the completion of these activities. So in this case, we have the number of sessions implemented, we have the number of people attending all these different events. So we'll now move on to the outcomes. In this project, most of the outcomes, all the outcomes, I think, are related to changes in knowledge, attitudes, and behaviors. And we can divide the outcomes into short-term, mid-term, and long-term outcomes. So we'll start with the short-term outcomes. The short-term outcomes, we think that the educational sessions will contribute to an increase in knowledge and awareness about disaster and preparedness, but also will contribute to an increase in risks perception and perceived vulnerability within the community. The workshops will contribute to that as well, but the workshop will also contribute to, will also equip the participants with practical and easy to reproduce skills. What will also do the drill exercises? So the point I want to make here is that you can have one activity related to one short-term outcomes or two or more outcomes. So I think it's important while building a logic model to clarify all these connections and to show how your different blocks are related together. But it's really important to make these connections, I think, really specific, because at some points, all the blocks are interconnected to each other, and you can end up with many arrows, many connections, and the risk is that you will end up with a logic model which could be difficult to read. So I think it's really important to think about and find the right approach between maybe too much details and clarity. We can take, for example, drill exercises. Drill exercises, we can assume that these activities would probably contribute to the three short-term outcomes. But I think that in this project, the main function of the drill exercises is to equip participants with practical skills, is to place them in a situation when we will have to adapt their behaviors. So this is why we have only one arrow connecting drill exercises to the short-term outcome, equip participants with practical and easy to reproduce skills. So then we have the mid-term outcomes. And well, it's a causal chain. So we couldn't achieve a mid-term outcome before achieving the short-term outcome before. So in this case, it is precisely because people have better knowledge about disaster preparedness that they will have a more positive perception of disaster preparedness. So They have to know more about disaster preparedness before considering disaster preparedness as something useful and positive. And then we have the long-term outcomes. And here we have a kind of intermediary step before reaching our final goal. So we think that to increase effectively the level of disaster preparedness, people should first have the intention to do it. So this is why in long-term outcome, we have also increased individuals and intention to engage in disaster preparedness. So as you can see, all the blocks converge to the main goal at the end, even though they will be taking different pathways. And the logic model is really good at demonstrating all these pathways. We can focus maybe on one pathway. If you look at the boxes at the top of the logic model, first we have some people who attend educational sessions and workshops. So after that, they have a better knowledge about disaster preparedness. This knowledge translates into positive perception, and this positive perception translates into intention to get prepared, which ultimately translate into preparedness. So there are logical connections between each of these boxes. And finally, we have the overall impact. So the overall impact is, what do you call it, an overarching goal that our intervention will have a contribution to. It's not, as McDonald said, it's not our final goal because many other factors will contribute to mitigate the effects of natural disasters on lives, health, and livelihoods. Our intervention is just one of these factors, and it would be really complicated for us to measure to what extent we would have a contribution to this goal. So I think it's really important, again, in a logic model to make it clear what is our final goal and what we can measure and what our intervention is accountable for. So yeah, just to conclude this short presentation, I would like to outline some questions that I personally find really useful when developing a logic model. So what is the right balance between details and readability? Because when you work on a project, you have a lot of information and you have an expertise and you want to tell as much as possible. And it can be a bit frustrating to simplify your project in a logic model in just a few boxes and a few words. But I think that it's good sometimes to accept this level of simplicity, if I can tell it like this. The second question is, are my connections logical and evidence-based? And there is something interesting that you can do with a logic model. When it's done, you can analyze all your connections, all the little arrows in the logic model, and try to make sure that all these connections are supported by evidence that you found in the literature. And doing this exercise will help you make sure that your theory is okay, that your theory is well transcribed into the logic model, and that at the end, everything is perfectly aligned. And the last question is, what is my intervention accountable for? What is my final goal? And what is possible to measure at the end? And to what kind of overarching goal my intervention will have a contribution to. So that's it for my presentation. Thank you very much for listening.
Thank you very much, Sebastian. That was really a useful way of looking at the logic between, how to align different components of the logic framework in that chain. And I think this is the key message that I think participants need to understand. Thank you very much, Sebastian. Thank you very much. I would like now to ask Dr. Nihal to present her work around mobile application to decrease e-cigarette smoking. Nihal?
Thank you, Dr. Khalifa. Hi, my name is Nihal Noor. I'm one of the MBH students. I'm proud to be part of this workshop. I hope everyone is going to have a useful time. So today I'm going to take you through the process of making a logic model for the intervention we have been working with through this master for designing a mobile application to decrease the e-cigarette smoking among the youth in Ireland. So next slide, please. So I used the logic model as an analytic tool to analyze my problem, to plan and to see what management I need for my project. So analyzing your problem first, what is the problem that you are trying to deal with? It's not violence, but it is the process of making the logic model. So increasing the use of e-cigarettes among the youth in Ireland was my problem. So why it is a problem, what is the side effect, how much is the prevalence? So I came up with the objectives and the goals I need to achieve through my interventions. And what was the objectives? So provide an integrated support system, provide a low cost and effective intervention, accessible by one click away for this population, promote the health equities. So my objectives and goals is going to be my main way of thinking, and then I'm going to try to find an intervention to achieve these goals. It's very important also to think about the context. Which country are you going to work with? What resources are you going to work with? The population, like I thought about number of high schools that you're going to approach, the population of the school aged in Limerick. So it's very important to have that kind of thought to make it approachable for your intervention to work. So next slide, please. So my approach to the logic model was putting that outcomes, short-term, mid-term, and long-terms, through aligned with my objectives and goals. And to make sure that my outcomes are going to have that part achieving in the impact, decreasing the e-cigarettes prevalence among the youth in Ireland. So I started thinking about the activities or my intervention that I need to put and achieve to have that kind of impact, which was designing the free mobile phone. And as Sebastian was talking and Mac was explaining too, that everything has a theory behind it. So in order to convince the people that you're applying your grant for, that what is the theory behind that intervention, how it's going to work. So the theory was behind my application was the theory of motivation. So I needed the resources like software companies, HSC guidance, the Department of Education and Skills, and also planning your monitor and evaluation from the start is important for your budget. So next slide, please. So this is my logic model. That was a part of a holistic approach. And because we had a defined budget, we had to go with one intervention. So the intervention that we need was going to be approach is designing the mobile phone application. And it's a behavioral intervention. And the output was designed one. Okay, someone is saying we can see the next slide.
No, it's clear. So maybe from their side. So
okay, so the output was designed one application for the iOS and one application for the Android to cover all the platforms, and my outcomes it was aligned with my objectives. So I was planning to do a change or a breakdown in the culture and structure barriers to seek that help for smoke cessation. Also change the perspective about the smoke cessation guidelines on a short term. And a midterm, what I wanted to achieve is increase that attitude or that behavior for stopping of the smoking. On a long term, we are creating an integrated support, a follow-up plan. We are creating and promoting a health equities. And this part of a small intervention is going to have a contribution to the huge impact about decrease the preference use among the cigarette smoking among the youth. So as you can see from the logic model, what kind of resources or inputs I needed, software companies, even social media for promoting. I needed the HSC and a medical consultation. I needed also the education department for skills to promote this in the high school. So putting resources and activities together to lead to that kind of outcome and impact is important, and working with your context is important too. So next slides. So evaluation, when you plan for your evaluation from the start, you're going to have to work with your budget. So when I started designing the application, I went through details with the phase, with what kind of intervention I want, what are the time frame. I even got a quote from a software company just to have that insight about how much money do I need. And for your evaluation, planning that backup service is going to be from the start of designing your application, using even application log entries, daily diary. It's all implemented in your application design. So it is important to plan for evaluation from the start, because you want to know, is your intervention going to work or not? How are we going to evaluate this intervention? Is it useful or not? Also evaluated on a long term, like a semi-structured interview after 30 days through the phone or through the questionnaire on the website, to make sure that your intervention is actually worth it and working. That's it for my intervention, for my presentation. Thank you.
Thank you very much, Nihal. That was a nice example of how also this component of the logic frame is aligned, are aligned in the same way, but also to look at it from different, angle, and start usually from maybe the outcomes rather than the input, and go in the opposite direction will help you also to think in a different way. Thank you very much, Nihal. Now we will have Dr. Asjad Ahmed to give us a short presentation around our experience designing a midwife-led pregnancy-centered prenatal oral health promotion intervention using a logic framework. Asjad?
Thank you, Dr. Khalifa, Nihal, Mac, and Sebastian. Today I'm going to be talking about my intervention. And what you have to take from this presentation is the logic model and how's that going to help you in having a successful grant application. So basically, it just helps you to put everything in its right place. And especially you have to give a good thought for your inputs and resources, as these are going to guide you for your budget later on for the grant application. Next slide, please. So a quick summary of what the intervention was. It's an educational and skill-based training intervention provided for the midwives, who will later on train and educate the low-risk pregnant mothers during their antenatal care visits. And why was this intervention done? To acknowledge the gap in oral health during pregnancy in Ireland. Next slide, please. So first things first, you have to think of your aims and objectives. Why do you want to do that? You obviously researched and found that there was a problem, okay? So what do you have to do to address these problems? My objectives, I divided them into 3, and these guided my logic model. As my colleagues said, I took a backwards approach, and I knew what the objectives were, and your objectives are your outcomes in your logic model. Your short-term, mid-term, long-term, you could just have short-term objectives and long-term. It depends on your intervention. Anyways, objectives are outcomes, and you walk backwards. That was my approach. My short-term objectives were 3 things: to improve and expand the knowledge, skills of the midwives about oral health, and reduce the misperceptions that it's not okay for pregnant women to go to dental clinics during pregnancy. And a 3rd one was to increase the referrals by the midwives for the pregnant mothers to dental clinics. The midterm were 2 things: is to improve the oral health knowledge of these mothers and to increase their dental care utilization. And the objectives or outcome was to improve the pregnant mother's oral health. Next slide, please. So just a quick thing, similar to what Max said, logic models, they're a visual representation of your intervention theory, activities, and outcomes. It illustrates how your intervention is expected to work by describing the logical linkage. And here, a key message is logical linkage, and there's an alignment between the components of a logic model. The inputs, resources, flows, or produces activities. The activities leads to outputs, outputs leads to outcomes, and outcome to a bigger impact. Sorry if you can. Sorry, can everyone mute your, thank you. So now we know what the logic model constitutes of: inputs, activities, outputs, and outcomes. You have to have two things. Another key message is your logic model should be evidence-based. You should have a theory behind it. And the third thing is you have to be sensitive to your context. You always have to contextualize your intervention. Next slide, please. This is just another diagram. It shows steps 1 and 2, your resources, inputs, and activities are your planned work. And steps 3 to 5, your outputs, outcomes, and impact are your intended results. Next slide. What are the uses and purposes of a logic model? It helps you across all the phases of an intervention: development, evaluation, and implementation. It helps you articulate how each input and activity will ultimately link to your intended outcomes. It will help you visualize and check that each activity and component is there for a reason, and it allows the scrutiny of the scientific possibility of the intervention. Next slide, please. Continuation here, it also helps identify weak links for you to change them or improve them during the development phase. It helps you highlight unintended outcomes, and these are harmful outcomes that you do not want your intervention to have on. It helps you also identify useful resource planning and staffing requirements, and this is very important for your grant application. And last but not least, it's a very good communication tool with your stakeholders and funders. Next slide, please. This is an illustration of my logic model. It shows the linkage and the alignment between my resources, activities, outputs, short-term outcomes, midterm outcomes, long-term outcomes, and impact. The outcomes, I repeat, are your objectives, and I place them first and then walked backwards. We'll just have one example. We'll take the first straw. I wanted to have a long-term outcome of improved oral health of the pregnant mothers. To do that, I first had to go back to my midterm outcome, and this is to improve their knowledge and behaviors on oral health. And to do that, I had to go to a short-term outcome. We're going backwards, where I increased the midwives' knowledge about oral health, and they were gonna inform these pregnant mothers during the antenatal cares. And then walking backwards, how can I improve the midwives' knowledge about oral health? I had to first train them, and this was my output. And how am I gonna train these midwives? I have to have online training materials for these midwives. How am I gonna do that? I need inputs and resources, and these are I need midwives, I need a public health dentist, and a periodontologist. And we can provide these slides and you can go through these other examples of the logic model. On the top, you have your context. You have to be very sensitive to your context and your population needs. And at the bottom is your assumptions, your knowns, what this theory or intervention will do. It will improve access of dental care, increase knowledge and attitudes about maternal oral health, and so on. There's an impact column, and the impact column is not necessarily something that you're gonna be able to evaluate on the long term or something, but it's just something that's gonna happen as a result of your intervention for the wider community. It's unintended, but it's a good outcome or impact. Next slide, please. So it's just, I'm not sure if you have to go in depth about this, but you always have to make sure that your intervention is successful and it will help the population. Like they need it, number one, and it is useful. How do you do that? Usually through monitoring and evaluation. And to do that, you need to have indicators. Indicators, in the context of program framework, they measure each of the program outputs, outcomes, and impacts, your intended results. And for each output, outcome, and indicator, there's a single indicator. So I'm going to give you examples from the next slide. Each indicator for each output. Next slide, please. This is just similar to the logic model. It's just a continuation of it. So you have, it just helps you visualize and think of every output and outcome and what indicators are they. I have 3 questions here. What do we evaluate? We evaluate our objectives. And how can we evaluate this? We collect data, and through what? And the last is the indicators. So similar to the logic model, we're just going to take an example or 2 examples of each. The first one is your output. I had an output of trained midwives. How am I going to collect or evaluate that? Through attendance sheets of who attended the training. And what is the indicator for this? It's the number of midwives who completed the training and educational online material. For your short-term outcome or objective, which is the increased midwives' skills in dental hygiene teaching, I'm going to collect that through questionnaires. And what's the indicator for that? It's a percentage of midwives who successfully completed the skills and assessment. Just a quick note, indicators, there are standardized indicators. You do not make your indicators. So you go search for, there are 100 core indicators by the WHO. You could look for national plan, monitoring and evaluation frameworks, and so on. And you look for these indicators. And I think that's about it. Thank you.
Asjad, thank you very much. That was a really good presentation. We had very nice, 4 presentations to complement each other and to give good examples of how to use logic model in a way of thinking to write for application. I have few minutes. So what I'm going to do before going to the next session, which is around design thinking, I might stop sharing my screen, just we can see each other. And I'm happy to take a few questions. So the first, if you want to ask a question, either you put it in the chat or you raise your hand. I have Jonathan. Jonathan, would you like to ask your question, please? So if you can unmute yourself, open your camera and ask the question.
Thank you, Dr. Khalifa, and thank you, Dr. Ahmad, for the great presentation, which built on the past presentations we had and gave me or us a very comprehensive outlook of logic model designing. I wanted to ask you about how a theory of a logic model can be best determined. Yeah, thank you.
Okay, thank you. I will ask Nihal, since Nihal, put that in her presentation and provided an example of a theory to, to support the logic model. And then if anyone from the panel would like to answer, please feel free. Nihal?
Thank you, Dr. Khalifa. So, Jonathan, so when you are designing your logic model, your intervention, you want to ask yourself, is it a behavior? Is it an educational? Is it a policy? What kind of intervention? What is the theme of your intervention? And then you looking up in the literature to support, because there are interventions that has been done carrying the same themes, and that's support from literature. So this is what I did actually. I did look up for behavioral theory of a change. What is the theory of change behind the behavior? So prime and motivational theory was one of the theories I found, and it was actually very related to the smoking. So and you will find through the literature, you will find everything that you are looking for. If it's a new one, it's going to be a little bit different. So I think maybe Dr. Khalifa is going to talk us about the new designing, or Dr. Noha. But if it's an intervention that is very much there, smoking is a cessation or stopping has been done for long years. So behavioral, going through the literature, ask about education, anything that is the theme of your intervention, and then look it up. And then I did find that motivation theory is behind it, and that creating that kind of impulse is going to prevent that act of smoking. So that's much what I did.
Thanks. No, yeah, and basically, if you are proposing a project or intervention, and you are claiming that, well, this intervention will lead to this outcome or impact, so do you have any evidence to support that claim? Are you sure it will work? Is there any evidence to show that it worked before? Is there any theory of change that we know that will support your logic model or your way of thinking that this intervention or these activities will indeed lead to this impact and outcome? So, Sureka, if you have a question, please, would you like to ask the question?
Yeah, thank you, Khalifa, for that wonderful presentation, and all your students and colleagues. Thank you. My question is, what is the difference between the output and outcomes in a logic framework?
Perfect. This is
How
a very good question, and usually it's a confusing question, and the answer is very easy. Outputs is related to your activities. Usually outputs are numbers of your activities. If you say that I'm going to do a training session, then the output will be the exact number of the training session. If your activity is saying that, well, I will train community midwives, then the output will be the number of community midwives that you are going to train, clearly. So outputs and activities are linked together, are the same thing, but then the number of the activities mainly. Outcomes is impact. Okay, what are the things that are going to change? Behavior, skills, knowledge, attitude. So these are the outcome of your project. As simple as that.
So do you think that the outcomes are linked to your objectives? If you go backwards, you first define the outcomes and then you go backward and define your activities. Is that what you want to say?
This is the best and smart way, because then you think from at the end, as you know, most of the presenters said, and you go backward. At the end, what do you want to achieve? I want to achieve this thing. Okay, what kind of activities can I do to achieve these impacts, right? And do we have any evidence to support that? As simple as that.
Thank you.
You're welcome. Okay, Judy, do you want to ask your question, please?
Okay, my question was, at the beginning of all this, how do you decide what the problem or the outcome is going to be? Who participates in that decision? Because how you define the problem is going to make a big difference in terms of everything else that follows. And we didn't talk about that at all. And I'm especially concerned about the community perspective.
So that's a very good question. And this is what we are going to cover in the next.
Great.
So the next session about, okay, now we know how to put things, you know, in an application and think in a logic framework, but we need to think differently. we need to think in a different way. We need to, use design thinking to come up with a project that actually meet the need of the community. So this will be maybe this a nice introduction to the next session. So I will share my screen now, and I will ask. Okay, let me share my screen. Okay, that was a nice question to introduce us to the next session, which is the design thinking. We need to think in a different way when we design interventions. I have three presenters who will guide us through the design thinking and evidence that we need to use for gender-based violence to design projects to prevent it. So I will start with my colleague, Noha. Noha will present a short presentation around using design thinking approach to generate projects to improve women health. So Noha.
Thank you, Khalifa, and thank you everyone from the MPS team for the presentations earlier. It was really informative. So for the design thinking, and maybe for the next slide, Khalifa, we start with what exactly is the design thinking. And the design thinking is an innovative approach in a way that it used to identify solutions for the public health problems, but taking consideration the end users of those services or products or interventions. And this is kind of answering your question, Judy, way to involve the community. And we all know about the community participation, but the design thinking is not only an idea or bringing this idea of community participation, it shows you in a process how to do this. So it's a key element of the design thinking approach as a tool in identifying solutions in public health issues involving the community and participation in this. And the design thinking is not based on the problem, focus only on the problems, but only end up with a proper kind of solutions for that problem. And in the recent publications, next slide, Khalifa. In a recent publication last year about the design thinking in public health, they claim that the use of design thinking approach when designing public health interventions will lead to better kind of collaboration for interventions from the community and more efficient interventions and even better satisfaction for the participants. They claim that design thinking, the teaching of design thinking, its important skills should be acquired by all public health professionals. That's why they kind of advocate for integrating the design thinking, the teaching of design thinking in all public health education. And we will kind of know in next slide, Khalifa, how to do this and why it is important. So when we talk about design thinking, most of the time we talk about 5 stages, how to do this. And again, as I said earlier, it's not only an idea about how to integrating perceptions and perspectives of participants, it's show you exactly how to do it. And the 5 stages that we're going to talk about it briefly in this presentation are the kind of identifying the persona that you're working with, the empathy, and we know what about it, and the defining the problem, ideation, and come up with prototype or specific solution. In some resources and references, you will find they put the 5 in a different ways they combine 1 and 2, persona and empathy, and add the 5th one, which is the testing after you have your solution, how to test, but more or less it's the same kind of approach. So if we start with the persona, what exactly is a persona? What do we need to know about this persona? So the persona is a fictional kind of character about the participants. And for example, in this context, there will be those you are going to do something around gender-based violence, but whom are you going to focus on? Next slide, Khalifa. So if you are going to focus on women or on men or on both or on boys or girls, you need to know a lot of information from the context around that kind of persona you are targeting. You need to know how they the context, the level of education, their kind of financial, are you targeting the married women? Are they targeting all women? We need to know all the informations about this kind of targeting population. In kind of the ideal things is to interview those people. You engage with them and you talk to them about and understand exactly how they live. And this will lead nicely to the next phase, which is the empathy. In the design thinking, the next phase is empathy. And in this empathy is kind of defined as you understand, not only understand, but you kind of go deep in understanding the feelings, the thoughts, and the fears, the needs and the wants from in those women or whatever targeted population you are. And while you are doing this, you have to set aside your own assumptions about the world, about the issue of, for example, if you go for a specific community, you want to target the gender-based violence issue there, you have to leave aside your own assumption about what you should do if you are in that community, because you need to listen to them without judging them in a very objective way. So this is, you need to understand, there is different kind of techniques we use for this emphasize or understanding the user's needs and wants. And one of them is the empathy map that we next slide, Khalifa, the empathy map, which the empathy map or the empathy interview, or there's different techniques that used in the design thinking workshop to understand this, empathize with the participants. But the key things, you need to understand, what do they say themselves about the issue? How do they feel about it? How do they think? What do exactly they want? And this is the line between what we want for them and what they want from us. And this should be kind of clearly in this empathy phase. And again, it is a skills acquired by practice, and be aware of our own kind of assumptions before going to these communities, because this will lead to a better action at the end. And this will lead to from this empathy and the persona and the reading of the context. Next slide, Khalifa. You will be able to identify all the known and the unknown about the topic. Now you know what the persona, what the people want, what do they need. You do some readings, you do have evidence about the topic. You do kind of draw all the context for this one. You identify the barriers, kind of the fears, the worries that the participants have. You'll be able to go for the next phase in the design thinking, which is next slide, Khalifa, the defining the problem. Next slide, Khalifa. The defining the problem, in this case, you have all the informations. Now you could easily phrase that problem in a statement that human-centered manner. You are putting the participant in the center of that problem. And this is why you want to find a solution for that problem, where they identify themselves as a need for them and for the intervention. Next slide, Khalifa. So now you identify the problem, you come up with a clear kind of idea what you want what the problem in that community regarding the gender-based violence, what are the women want, what exactly their needs or their wants in that community. So we go now for this ideating phase number 4. Next slide, Khalifa. And in this ideation phase, where you will come up with ideas, this is where the creativity and the innovation come. You need to think outside the box and look for alternative ways of viewing the problem, identifying innovative approaches and problem statements for the problem that you create. And this innovation is not only important for competing kind of application for funding, because you need to show and stand out in your application, but it's important sometimes to solve the problem that, there is so many interventions that kind of dealing with the issue is the same way all the time. You need to think outside the box and come up with new ideas that might help in dealing with this challenges and sometimes wicked problems. And again, there is different techniques that we use in design thinking for ideation, like brainstorming, brain map, mind kind of reverse thinking, and different techniques, but all of them will kind of encourage the ideation and the process of the ideation create. And when you think about this, like for example, this brainstorming, how might we know the problems, that we identify the challenges and the barriers, how might we find solutions for those women who are would like to be a leader in the health in their communities. They would like their voice to be heard. They would like their kind of husband stop hitting them. They would like to have education. So how might we helping them? And in this brainstorming, regardless of the technique we use for ideation or creating ideas, there is key 7 kind of rules that we apply in this ideation phase. So what's recommended in this phase, as the expert in design thinking say, in a good session of ideation, 1 hour would be enough to create 100 ideas. And when you go for ideas and thinking how to think about it, we don't think at this stage in a more kind of logic, practical way. So we allow our brain to go wild, as we always say, and we don't judge. This is a judge-free kind of free zone. And when we are as a team, this is why we put all the brains together with all the experience and the knowledge we have from the previous stages. We come up together, and all of us, regardless of where we are in the team and where we are in the experience and in the work experience or the experience in the field, we have something to contribute. And we go for, okay, any ideas. If you think that taking them to the moon, that will be an idea, put it that way. Put those ideas, regardless of how unrealistic or unpractical, put them, those 100 ideas, and then we will kind of cut them down to 30 or then 10 and then top 3. But maybe while in this process, you come up with the 3 ideas that you are going to take for the solution, you might use idea number 77, combine it with idea number 3 to have the solution for the problems. So what in this ideation phase, all what you need is a quantity of ideas. And then we encourage wild ideas, think outside the box, and this is what you think, and build on the ideas of others. So be as a team, welcoming everyone to contribute at this phase, and never, for the junior, for example, members of the team, don't feel that you don't have something to contribute because of the lack of knowledge. Sometimes that lack of knowledge is good for creativity and innovation. And as kind of some authors claim, sometimes our previous knowledge, knowing so much about the topic, will be a barrier to creativity. So all members in the team are welcome to contribute ideas, and all teams add on those ideas and not kind of rejecting or judging any of them. They need to stay kind of focused within the gender-based. I know sometimes things go outside, but the focus will help to develop those ideas. And if possible, be visual, kind of sketching those ideas so people around you will understand, try to build, try to visualize and see how this is working. So at the end of this, you end up with 3 ideas that you think that would be the best ideas and this will take you to the next step, which is the prototype, and having a clear possible solution for the problem you try to address earlier. And when it's an inexpensive solution, because you already have $1,000, you don't have that much, unfortunately. So you don't have enough money to build a school and a hospital and do your intervention. However, all of them are valid kind of good cause to fight the gender-based violence in any community. But we need to take in consideration this prototype could be a product, it could be a service, it could be intervention. But if you sketch it and draw it, you'll be able to see it. You don't need to be an artist. Just kind of sketch anything on a paper. Ask others to contribute and see how they see your idea. How do you think if this is working or not? Involving the community definitely, and always on all these phases, involve the members of the community and see kind of how they visualize or accept, or how this is answering their needs at any stage. So, and there is a different kind of, especially this after this lockdown and COVID, we go a lot of online resources. Usually the design thinking workshops done in a room where you have the boards and you start writing and putting sticking notes and all this. But even with this lockdown and with being online interaction, there is online facilitating tools like Miro or Moral. There is different kind of online tools that we could use for collaboration and team kind of engaging in different phases in the design thinking, like brainstorming or even sketching, or that. We use Miro in our program, but there is others as well. There is cost related to this, but for education institutes, I think there is kind of free educational plans for those ones. So, I mean, and the summary of this, just if we take home messages, the design thinking kind of approach or the stages are very useful for engaging and bringing the perspectives of the community that you are targeting on. That's the way the contextualization for your kind of interventions will happen, will lead to more kind of ownership. The community will feel the ownership of this kind of interventions, will reduce the resistance against your intervention, especially with this sensitive topic, will increase the sustainability of the intervention and even the scalability for this one for later on, which is something we need to consider when we do anything. And for your, as individual career professional, public health professionals, it will show you later on, be easier for you for kind of for your track records of funding for the next step. If it's working, you'll get more funding and hopefully will prove that this is working. And I will leave it now, and maybe when Anne, my colleague Anne, talk about it, will give you more kind of idea about how this is working in real life.
Thank you. Thank you very much, Noha, for providing us with a clear map of how to use design thinking in coming up with new project or redesigning a project or redefining an intervention in the community. And remember, one of the requirements of this mini grant that you need a team of 3 people: a student, a staff member, and a community representative. And that was done on purpose, because by doing so by default, we can facilitate dialogue and participation between community, academia, and young professionals or future professionals as well. And this design thinking approach will help the team to think together and come up with an intervention that will work for the community, not an intervention that we want, but what the community needs and want. My next presenter is Anne, and Anne bringing more than 20 years experience working with disadvantaged population in Ireland here, and she's going to talk about 2 projects: urban greening for better health and smart traffic lights. 2 different projects, but it will tell, those projects will tell the journey using design thinking approach to reach an intervention that will work in the community. So, Anne.
Thank you, Dr. Khalifa, and thanks, Nuha, for inviting me along today to talk about these 2 projects. They're both, I suppose, fictional projects in that we design them in the classroom as part of the master's program. But nevertheless, they're I suppose they're 2 projects that look at interventions that could be easily developed to support an aging population in terms of the smart traffic lights and better public health in any urban space in terms of the greening project. So I'm going to very quickly take you through both of them, but first I'm just going to look at the main headlines for me and how the design thinking approach really helped me in these two interventions. So I think, first of all, as Nuala has touched on many of these, it's human-centered design. That's what we're talking about, is making a difference to the health of the population through building solutions that are based on people. So very much foundation in reality, in people's lived reality. And in your case, you're looking at, you know, young girls and women and how they're impacted by gender-based violence. Empathy and engagement are really the foundation and the key ingredients to any approach. And I think, you know, as Nuala has explained, empathy really is putting yourself in the shoes and stepping into those shoes of the girls and the women that you're going to be looking at, and the context of their lives and how they are living and how they're being impacted by a variety of different issues that are going on around them. And so for any design, you know, that is really the foundation, as well as the engagement piece then as well. So we need to be engaging with the population or the individual and making sure that they're represented appropriately, that it's meaningful engagement, that it's not tokenistic, that we are interviewing people, and that as well as that, that they're part, maybe they're represented in what the design looks like at the end, so that there is a clear buy-in from them, that this is something, this intervention or this program is really going to make an impact in their lives. You know, the question was asked earlier about figuring out the problem is, you know, and I think that's key, and that's what design thinking really allows us to do, is what do we know about this issue, but equally what we don't know. And I think design thinking is such a useful way of really picking that apart, because sometimes, you know, as Khalifa said earlier, we can be working in a certain area and think we know everything there is to know, but when we actually sit down and brainstorm, that can be very often not the case. Because I'm very interested in sustainable solutions, whether it's to housing or how we live or our environment. I think very often it's about reframing or redesigning maybe something that's already there and adding functionality, upscaling it a little bit. It's not always about, you know, creating something new. There is a place for that, but very often it's about, you know, looking at what's there and how to make that better. Being bold and thinking outside the box, of course, is what design thinking allows us to do. And I think that's, you know, that's really welcome. And it's an opportunity to really kind of extend your horizons, be a bit silly, you know, if you want to be, and go on, you know, and look at it from all different angles, but not to worry about, you know, spending too much time going off, because if you have the person that you're designing the solution for at the center, so you're tethered to them, you're not really going to stray too far away from them by being bold and thinking outside the box. I think it's really key to take that approach. Be prepared equally to experience a mind shift. I think we've all probably done that anyway in the last 12 or 18 months, in terms of, you know, today we're online, much of our learning, much of our work is online. And it's about really, I suppose for me, this is something that I learned because I hadn't done that in my previous work, is looking at the possibilities, the digital possibilities that are there to support whatever initiative or program you're building. And then finally, I suppose, in terms of design thinking, just to be aware of the barriers that we ourselves might bring. You know, there might be some skepticism coming to this kind of approach because it's really creative and it's very much about using that side of your brain. And, you know, just recognizing that for many of us, there's a bit of fear around that, fear of our drawing skills and using those kind of skills that we mightn't always do. But it's about, you know, investing the time in it and building a culture in your group, whether it's 2 of you or 3 of you or however many are in your group, a culture that accepts that this is the way we're going to do it and we're going to be a little bit creative around this. And that, again, perfectionism really isn't the end goal we're looking for. I mean, if you're trying to be creative, you can't really look for perfection either. So the next slide there, Khalifa, these are just a snapshot of the 2 projects I'm going to take you through, one of which I was involved in myself, the urban greening for better health, and the second one, which is the traffic lights, myself and Nihal, who you heard from earlier, and a couple of more people on the masters were part of that. It's the next slide. So this then is the Miro board that Nuha spoke about. It's a really useful tool. It's free, it's online, to bring ideas together. So for the traffic lights, the traffic lights that we were designing for older people, the smart traffic lights, first of all, we considered, well, what do we know about the experience of older people? What do we not know? What are the problems? And what are their needs? So this was us as a group coming together and just penning a whole load of Post-its. This is what we know, this is what we don't know. And very quickly, I guess, when we stepped back from it, we were able to see that 4 themes were emerging: financial, social, physical, and psychological. And as you can see there are over 50 Post-its, varied from finding work to food security to financial security. So then next slide, Khalifa. We brought that further. We looked at their needs, and this was the next step in the ideation and the brainstorming. And we broke down the needs into security, mobility, mental health, physical activity, applied technology, and physical health. So this is what it came. This is what had come out of the first brainstorming session. And again, we have, I think it was over 20 ideas here, ranging from trousers with airbags to older persons Olympic Games, to falls monitoring, adopt a granny, all of these kind of things. And there was no real parameters. These were all of the ideas that we had. Next slide, Khalifa. So this then led us to the, I suppose, the more refining, the sophisticated stage of, then your aging demographic is at the center, but it allowed us to stretch the ideas just a little bit further. So what are we actually talking about? We're talking about older people's mobility. We're talking about their accessibility, isolation. What are we talking about in the psychological component? Loneliness, loss of sexual desire, loss of independence. The physical, loss of muscle mass, bone mass, things like that. So it really allowed us to kind of add more, another layer to our ideation. So next slide. So then we were at the refining stage. So these top blue Post-its are the top 10 ideas that we felt, right, there is some substance to these. Let's discuss these further, which then led to the last 3, which are the 3 ideas that we kind of settled on: smart traffic light, the fall monitor, and the helmet for neuroactivity change. And we picked the smart traffic. Next slide there. Again, the empathy map, a really good tool, because it allows us to put the older person at the center again. And what are the big issues for them? What are they saying? They're afraid of crossing the road. They're afraid of the speed of the cars. They feel nervous while crossing. So what then was that task that was presented to us, or the task that they have to accomplish, which is to cross the road, cross the street safely, you know, the timing of the crossing to be increased. And what were we influenced by? So the timing, the length of crossing, which was a big thing, the speed of the cars, the behavior of the drivers. And then finally, where we were trying to make an impact was to decrease road traffic accidents and to overcome the psychological fear of crossing busy roads, and to ensure safe and adequate crossing time. So I think the empathy map gave us a real kind of more thorough understanding again of what it is to be an older person at a set of traffic lights trying to cross a busy intersection. So next slide there, Khalifa. Another really useful tool is the stakeholder mapping. So that's stepping beyond the older person again, but making sure that they're at the center. Their safety, their health, their autonomy, and their independence. That's what we were concentrating on. But in the stakeholder map, we also looked at other demographics that may well be impacted positively with our intervention. And they're all connected to the older person. So for example, their family and friends would feel more secure that their mom or their grandmother or whatever was able to cross the road more securely, more safely. The health system would be impacted positively because there's a less burden of admissions due to road traffic accidents. The traffic engineer would have an easier job because there's better traffic flow and there's more organization around maybe more vulnerable road users. The tech industry would benefit in terms of they're bringing a new product to the market, they're increasing their profit margins, and government and regulators overall would benefit in that there's better economic flow, you've more you've more older people maybe spending money coming into town, things that they mightn't have done when they felt that it was unsafe. There's less health expenditure, more affordable cities, and of course, happier citizens. Next slide there, Khalifa. So again, this is really the creativity at play. We got to the stage where we were drawing, well, what are these ideas in our head? How does this look like? And this is what it felt like. It saw some of those images. Next slide. This is the prototype development. This is where we got to play. We kind of took some images of the existing traffic lights and what we were thinking about when we were mocking up a prototype of what that would look like. Next slide. And then this is just some more imagery we took about what designing this kind of interactive traffic light would look like. But again, very low fidelity modeling. Next slide, Khalifa. So that was the smart traffic light. And that was a really, I think, design thinking really helped us to navigate that project. This is an individual project I did myself, which looked at urban greening for better health. So basically, it was looking at informal spaces, neglected urban pockets of space in underserved or disadvantaged areas in Limerick City, where with very little intervention from the local authority or the council could be brought back and made into really usable green spaces, something that's really relevant at the moment in Ireland due to COVID, because we're restricted to 5 kilometres movement about. So again, Trello is a digital platform. It's a project management tool. It's free. We can, you know, anybody can download it, and it's basically designed, as I said, project management. So it's based on a set of lists, and each of the lists has a card. So for example, I set it up so it's to do, doing, done, and then an educational list. So I just took some pictures of a neglected pocket of space that nobody uses other than dogs at the bottom of my road. And I felt that, okay, with some engagement with the council and the neighbourhood, we could maybe develop this pocket of space into a usable green space with a little bit of biodiversity, a little bit of shelter, someplace to sit, bring a child or an older person could sit there with very, very minimal input. So that if you just want to bring it on to the next slide there, Khalifa. So it's under the to-do list, I just posted some images of you know, what it looks like currently, and then as well one image of what it could look like. So again, Trello it's a very useful tool. The if you want to go to the next slide, Khalifa, the last list is an educational one. So anybody that would be interested in getting involved in, you know, bringing pockets of space in their neighborhood back to life could learn more about things like, for example, how a tree in their street or their vicinity would be able to support better biodiversity and better living in their community. So I was able to add different things like that. Next slide, Khalifa. So that's really it. I suppose there are two examples of how design thinking has helped me. And, you know, the last thing I would say is that, you know, it's really important when we are designing that we think of the diversity and the diverse populations, I suppose, within the cohort of the population that we're trying to design for. And you should really kind of not run into any difficulty then. So thank you.
Thank you very much, Anne, for this practical presentation to give us, you know, more insight on how design thinking might be useful to rethink about intervening in the community. Thank you very much. I would like now to invite my colleague Sonika to talk more about what are the, you know, there are many evidence and resources, but we would like to focus on one platform that will provide evidence and resources that will help a participant to design their projects for gender-based violence, and this is the website. But Sonika will give us a tour in that. So and after that we will have questions and answers. So I will stop my presentation now, and Sonika, if you would like to share your screen.
Are you able to see my screen?
Yes.
Thanks, Khalifa, and thanks to all my team members for presenting the concept of the logic model framework and the design thinking approach in a simplified and interesting way with examples. So, sorry. So now I'll talk about the various evidence and the resources which are available on gender-based violence, including the impact of the COVID-19, which is the main focus of the WHTF mini-grant applications. So I would say that while designing your projects or intervention, you don't necessarily have to start from the scratch. There are enough available resources which are evidence-based and which can be used to design the project or the intervention. So today I'm going to talk about one of the main hub called as what works to prevent violence against women and girls. It is an innovative global program working on in 15 countries across the world and building evidence base on what works to prevent violence in low and middle income countries. So I'm going to take you quickly through the website and what all resources they are having. So this is the home page of the website. This website contains details, findings and results and lessons from the rigorous evaluations across the 15 countries and Africa, Asia, and the Middle East, and what works well and what doesn't work well to prevent the violence against women and girls. And the results have shown that the violence against women and girls is preventable. So this is about these are the areas where they work. It's like Afghanistan, Bangladesh, Democratic Republic of Congo, Ghana, India, Kenya, Nepal, Pakistan, and all other countries in the Africa and Asia. So, and they work on various themes. The themes are violence against women and girls, and disability, or education, or economic costs, and the costs of violence. These are the various themes where this the what works to prevent violence they work. So okay, so now going on to the evidence hub of this website. So they have a hub with all the evidences available. So they have a peer-reviewed journal articles. You can you can even search the journal articles based on the themes or the country or the project. Like you can select those, and these are the various peer-reviewed journal articles, like for instance, the barriers and facilitators to care seeking among survivors of gender-based violence in the Dadaab refugee complex. So you can find there are evidence reviews. Violence against women, against younger and older women in low and middle income countries, which has shown that the young women are at great risk of physical intimate partner violence than older women. So these are the various evidence briefs, reviews which you can find on the website. And then they have evidence briefs. Economic and social costing of women against violence against women and girls, and intimate partner violence in Nepal. The change starts at home study. So you can get an idea how they worked in Nepal and other countries, what were their study objectives, how they went for it, and what all the evidence was generated, what were the results, what were the findings. Similarly, you can find on various reports and toolkits, so you don't have to develop your tools, or from the start you can use the already existing tools. So it's like research to action toolkit, violence against women and girls in conflict and humanitarian settings. So like that, there are they even have the various presentations on the various topics on violence against women and girls. So you can have a look on them, and even the videos. There are lots of videos available, which are like for 2 minutes to 6 minutes or 7 minutes, and they can give you an idea about what the project was, what were their foundings, how they go for it, what were the challenges they faced. So these all they even have the stories of change, like how they what were the stories, how change stories. So like for instance, this is two tales about the power of play, Pakistan. It is a story about a 12-year-old Pakistani girl Manhoor, she actually struggled and managed to break free from the assailant and sprint back home, and it was due to the power due to the power of play project which they started in Pakistan. So similarly, you'll find different stories where you can get ideas of your design or the project or the intervention. So these are the various resources. So you can I would say that you can review these resources, and that and if you find them appropriate to your settings and your context, then you can adapt and implement them in your settings with necessary acknowledgements. Along with that, I'm just gonna stop sharing and again sharing. There are just a minute. There is another website, it's UN Women. They also work for ending violence against women, and they have many resources on the violence against women in the current scenario of the pandemic, the shadow pandemic, domestic violence in the wake of COVID-19. And so indigenous women in Colombia, Ecuador border are leading community efforts to end violence against women. So they have many other resources which you can go for COVID-19 and ending violence against women and girls. So this is also another major focus area of the WHTF grants where you can get idea from. And similarly, there is one more website. Just a minute. It's about it's on the by the World Bank. I'm just sharing that. It's through the World Bank, gender violence against women and girls. So here also you can find various resources. This World Bank supports over $300 million in development projects aimed at addressing gender-based violence in World Bank group financed operations. So you can also have a look at this website. So the main the take-home message by giving you these available evidence is that you can review these resources, and you can use these resources in designing your project or intervention and get an idea and use the available toolkits, because in the view of limited resources you have in the terms of money, manpower, or the time. So these available resources can help you in designing your projects and interventions. Thanks. That's from my side.
So thank you very much, Sonika, for that presentation. So today we provided introduction to the mini grants. We also talked about how can we use the logic framework to improve our writing, and how to think differently and engage different voices from the community and from different professionals to think not necessarily outside the box, maybe at the edge of the box, maybe within the box and someone at the edge. And so just we need to think in a different way to redesign and have a good alignment of what we are doing, because this what we will be used to evaluate your application. And then once you are successful, this will help the team to monitor and evaluate your project at the end. So I still have 15 minutes to take few questions. I will start with Amani. Amani is the chair of the mini-grant. And Amani?
Yeah, thank you, Khalifa. Welcome, everybody. I'm here to answer any question regarding filling the application, okay? But before answering any question, I have a question for presenters. You did wonderful job. Thank you all. Did anyone, how much was the cost of any projects of yours? I'm impressed by the last one of the smart traffic lights. You implemented that in your city. How much was the cost?
Thanks, Amani. We didn't actually implement it in the city yet. It would be great if we could. It's a project we designed as part of the master's program. Okay. And I guess it's something that, you know, that I'm very involved in terms of active mobility and vulnerable populations and universal design for, you know, older people, younger people, and the benefit, I suppose, that reaps for everybody, you know, not just those demographics. But I think smart traffic lights have already been designed in other cities, certainly not in Ireland, but it's something that it was a prototype we developed together to try and, you know, bring in a kind of an intervention for an aging population, but we haven't brought it any further yet.
Thanks.
Okay. Hope it will be done one day. Yeah.
Yes.
Thank you, Anne. Thank you, Anne.
I will take few questions from the chat. So Mitra, would you like to share your question and maybe Azjad my reply to that? Mitra? Mitra, are you with us still, or if you hear us, maybe you just need to unmute your okay, maybe Azjad, you already know the question, so if you want to you know, just to reflect on that very briefly, and then I will. Hello, Mitra?
Hello.
Yes.
Can you hear me, Khalifa?
Yeah, I hear you, Chapra.
Good evening, everybody. So glad to see everyone. Everything was excellent. All the presenter. To be very frank, it was a pleasant surprise for me. I had expected something else in this workshop. Maybe I missed some mail, but this was a real excellent surprise. So my congratulations to you and your team. And I'll send a mail as we finish this. Thank you.
Thank you very
Dr.
much.
Chapra. Yeah.
Dr. Chapra. Azjad?
Hi. So like gender-based violence is very deeply rooted in most of our cultures. It's just maybe unspoken about, or it's more spoken about for like in low middle income countries. And as any global issue, we have to find holistic approaches, and policies are very important to address these problems. And a design thinking approach is a very useful way. It helps you really empathetically through your empathy map. As Anne mentioned, you just put your population or your persona at the center, and you just really think about them. So you have to sensitively think about them. And one, like many of the ways of formulating an empathy map is either through interview or by like in context, what is it called? In context emerging, like, so you either observe them or you shadow or you have a day in their life to know what the problem is. And this really will help you later on to formulate a solution. And for this grant application, I believe you have to put in mind, like you just have 1,000. So you have to think of a solution that is applicable within your 1,000.
Thank you, Asjad. And as we usually say that the intervention need to be smart. So low investment, high impact. There is a question from Blessed and Jonathan. They're same question. So Blessed, do you want to ask your question? You might, if you can unmute yourself, and otherwise I can ask the question. Yeah, Blessed, go ahead.
Okay. Yeah. Good afternoon, everyone. Can you hear me?
Yes, we hear you clearly.
Hello. Hello. All right. Thank you very much for the workshop. So I just want to know what the timeline or time frame is for the implementation of the project. Is there any duration given for it to be achieved, or
yes,
or
yes, I will answer that. Yeah.
Timeline.
Yeah, the timeline, it is expected that the due time is the 2nd of May, this May, okay? We will review it and we will come back to you by the end of May. The working group, the grant, will review all the application. So the applicants start from June to be implemented till the end of January 22. We will hope to do another workshop with all the grantees but in February 22 to review the results with them. This is, and maybe after that we will do publication together, and maybe in May or June 22. This is the proposed timeline by the group.
So Amani, just to clarify that, so the duration of the project to be implemented is 6 months?
Almost a year, from May to May, because the implement till the end, the activities itself would take from June to the end of January. Yeah.
Okay, so 7 months. So they are asking about that exactly. So what is the duration of the activities? So it will start in June and finish by end of January.
Yeah.
So we're talking about
because
6
we were
to 7
hoping
months
to have another workshop in February. However, we will be flexible about that with the grantees. We can communicate with them if there is any problems or barriers or anything. So this is the timeline. It is usually a 1 year duration. The mini grant is 1 duration. Okay, so by the end of the year, it would be presentation of their projects.
Okay, and I think that will be clearly indicated in the website with all the timeline for that. Okay, thank you very much.
Thank you very much.
And thank you, Jonathan. I will ask another. I will take another question, and we answer that for Jeffrey as well. Okay, Dr. Bangal, do you have a question?
Hello, Khalifa.
Yes, go ahead.
Did ask the question, but I got the answer also. Amani just explained the timeline. When will grant be released? The projects are selected. When will grant be released? When will grant be released?
Yeah. Well,
after the when the projects are sort of selected.
Okay, so I will. There is another question from Sorika, and then I will ask Amani to reply to your question, Bengal and Sorika. So Sorika, do you want to ask a question?
Yeah, I just wanted to know about the budgeting. Is there a template or something which can guide the participants about how to talk about the budget, in the proposal?
Okay, so before giving the chance to Amani, I can comment on the budget in general. So usually when we evaluate any grant application and look at the budget, the budget itemization is important. The justification of the budget is important, and it should link to your input of the logic framework. So you need that kind of alignment for the budget. But I will ask Amani to comment more on this. And when are you releasing the money? Are you releasing all the money at the beginning, or is there a percentage at the beginning, percentage at the end when they submit their report, or what is the arrangement for that, Amani?
We will work to first in reviewing the applications. We have to take the vote also from the board of the Women Health Together for the Future. And Judy, if you are here, you can join that discussion too, because we will. I will answer for Sorika. Thank you for raising this point, because I'm the one who developed the form for the application, but I didn't make a specific form for the budget. Maybe I will work on that, okay? That would be very nice, and I will deliver it soon to if it is needed, because I didn't think that it is needed as a form to fill the budget items, but we can do it and share it with the applicants if it is needed.
Okay.
There's a question about from basic research. Yeah.
I will. So Jonathan, you have another question. If you want to ask, please go ahead.
Thank you, Dr. Khalifa. I wanted to inquire about the type of work that the grant is meeting. Could the grant be able to meet a basic research project, or it's basically focused on running an intervention research project?
Okay, so I will speak on that a little bit and then provide it to Amani. And this is my personal opinion. I'm not part of the mini-grant committee, but my personal opinion that this money should be used to design and implement projects that will actually lead to reduction in the gender-based violence. It's an actual project, not a research. I think there is enough research done. There is enough evidence that will tell us, why gender-based violence is an important issue. What is the implication of that? There is huge evidence for, evidence on what works to prevent. I think it's time now to use this evidence to do something and to see impact and share those stories. So I think, and this is my personal opinion here, that we shouldn't fund research projects. We should fund projects that will make an impact on women and girls suffering from gender-based violence. But Amani is the chair of the mini-grant, so she will.
Yeah, it is mainly interventions. But let me remind you by types of research. It is not all descriptive. If you have interventions that succeed, and as you see in the slides that Sonika shared, there what is working. So you can add to the body of knowledge by your intervention, which is not only direct benefit for your community or for your, but you will publish it and you will share that as a research also, because this is an intervention research later on. But the main focus is to help the community or women or whatever your partner would be, because you remember that you also will have in your team students that will carry on the torch after that. So you are training for the future, not only for now. And the community partners, you have to have a community partners. It could be an NGO, nonprofit, whatever. The community could also be your university if you have a community, because community has a very wide description. So it is mainly intervention. All of us who had many grants before did intervention work, and then this is a kind of research. This kind of research, you publish it and it works because you give the evidence of what is working to prevent or to modify or to change in your community regarding GBV.
Thank you very much. It's now 3 p.m. and before handling,
if I can just clarify two things. One is
I will give you the chance, and then you maybe answer the question, maybe conclude as well.
That's the question. Yeah, I wanted to answer the question.
Yeah. Before handling this to Judy to answer the question and conclude the session, I would like to thank my panel today for their contribution. It was really a nice, not really academic and not really practical. It's a kind of a mix between them, but tailored to help applicants to apply for this for this workshop. So thank you very much. Back to you, Judy, to answer the question and conclude.
Okay, well, first of all, I would also like to thank the panelists and you for doing such a lovely job with the workshop today. I think it's been very helpful for people. I just wanted to respond to the questions about, so the decisions will be made about the grants by the end of May. The money will go out beginning of June. It will be transferred to the applicants and it will go in one lump sum. So I hope that answers those questions. But then there'll be follow-up on it, but it's not enough money that we want to do, multiple payments. So we will be available to help support people as they move forward with their proposals and their grants. That's the plan. So it will be pretty direct. So thank you all very much for joining us. We hope all of you who are interested will be able to apply. We're really excited about seeing your proposals. And I'd just like to thank everyone for their participation.
Thank you all.
Thank you very much. Maybe just final comment, we will send an email for, to evaluate the workshop. At the end of that email, you will, once you submit the evaluation, you will receive the PowerPoint presentation of this slides at the end of the evaluation. So watch your email for this evaluation link. Thank you very much.
Bye, everyone.
Bye.